Yeah, thank you very much. At the outset, I would like to thank the organizers for inviting me to conduct the workshop on diabetic food. And if I have to say, in the entire spectrum of diabetes, diabetic foot is the ideal condition where diabetes educators can play a major role in preventing and even taking care of existing diabetic foot cases. Basically, in diabetic patients, we have two types of problems. One is neuropathic foot, where nerves are affected, and neuroischemic foot, where blood vessels are affected. But today's workshop will highlight only on neuropathic foot because it is more relevant for educators. Basically, God has gifted us with protective sensations like touch, temperature, pain, joint movement, and vibration. These sensations are present all over body, and they are protective sensations, and they protect us from all injuries. But in diabetes, the feet lose these protective sensations with the development of diabetic neuropathy. And I remember that this pain was referred as the best gift the God has given to us. But nobody likes to have pain. But pain is extremely important. If you don't have that sensation, the entire foot becomes at risk. So all these sensations are specifically lost in feet of patients with diabetes, what we call as diabetic neuropathy, and it's also called as loss of protective sensations. And they, with the loss of these sensations, the feet become vulnerable for various injuries. Look at this feet. You can see the patient had lost the protective sensation. He went to a temple in summer month of Nagpur where the temperature is 45 degrees centigrade, and you can see with barefoot walking, he has burned his plantar aspect completely because of he couldn't feel the temperature. With the certain steps, we can prevent majority of amputations. And what are the detection of high risk feet, good patient education, advice on sensible preventive footwear, and taking care of trivial foot lesions. If we follow these four things, we can prevent majority of leg amputations in our diabetic patients. We are now seeing the video of foot examination.
सर सर वीडियो का ऑडियो नहीं आ रहा है.
He's explaining the examination of foot, seeing the back of the foot, and you have to look at the tip of the toes and between the toes. You can see in between toes for any fungal infection or abrasions. You have to also check the nails of the patients. We have to, planters are the most important component of diabetic neuropathy, which are, and as I said, vascular system is also involved. So we have to always look for peripheral pulsations. He is examining dorsalis pedis. This is medial malleolus, and posterior to that is posterior tibial. So these two peripheral pulses should be always examined in all diabetic patients. We can also look with our hands the temperature and movements of the joints, and we can then diagnose diabetic neuropathy with some simple instruments like this 10-gram monofilament and see whether patient feels. With vibration sensation can be tested with 126 hertz uh, ratiometer, and blood supply can be tested with ankle brachial pressure index, and this is biothesiometry. And the indicators of neuropathy are dry skin, fissures, the deformities like toe deformities, valgus deformity, prominent veins on the dorsum of feet, and hammer tombs, base callus, and look for the callus at the prominent metatarsal heads. This is the final end stage of neuropathy. You can also look for veins. Nails are also crooked in diabetics and they injure the neighboring toes. The indicators are loss of peripheral pulsations, loss of hair, and dusky skin on the dorsum of the skin. And this is how the neuroischemic ulcer looks like. And the infection can be detected when you see a purulent discharge from the ulcer, maceration, fungal infection in between the toes, and redness, erythema, and swelling of the foot. After examination, we should be able to categorize the patient and his risk profile. If there is no sensory neuropathy, patient can be checked once in a year. If neuropathy, once in 6 months, with signs of peripheral vascular disease, once in every 3 months. So this regular checkup is extremely important. And if the patient has history of ulcer, then we should advise for proper footwear. And these are the footwear we should advise. You can see for the good toe box, they should at least have laces or Velcro belts. It has to have a heel counter and without any traumatic stitches. It has to have an insole, soft insole, and tough and outsole. As we see with neuropathy, it involves the sensory, autonomic, and motor neuropathy. And with sensory neuropathy, there are loss of protective sensations. With motor neuropathy, there is atrophy of the muscles, leading to all these foot deformities that we see. And because of autonomic involvement, there is no sweating, and feet of such diabetics are dry and they easily get ulcerated or cracked, and we get a lot of deep fissures in such patients. With the motor neuropathy, you have these deformities, and these create pressure points on the dorsum as well as on the plantar aspects of the toes, metatarsal heads, and these increased plantar or dorsal pressures make the feet susceptible for foot ulceration. This callus development finally leads to a typical plantar ulcer, which is seen on the heads of the metatarsals. And this is the characteristic neuropathic ulcer. Next. Now, I will try to demonstrate. Are you able to hear the video? Do you hear the video? Now we have kept some wooden blocks, and the sizes of the blocks is reduced gradually. So she is asked to walk on these wooden blocks, and we'll see how comfortably she walks until the area of the block becomes smaller and smaller. And now she says she is unable to bear the pain because she has normal sensations. And when she steps on a very small block with hardly any surface area, she is unable to stand and cannot bear. In diabetic patients, they can bear the pain because there is no pain. We have to remember that vertical pressure is inversely proportional to the surface area. So smaller the surface area, more is the plantar pressure. And in diabetics, because of foot deformities, the surface area is shortened or smaller, and vertical pressure becomes more, and that's why the callus develops. Now, with the autonomic neuropathy, the feet are dry and they are susceptible for deep fissures. You can see almost the subcutaneous tissue, and each fissure is surrounded and by thick callus. And unless we remove this thick callus around the fissure will never heal, and this opening will pave way for microorganisms and can lead to deep plantar infections. And this video will show you how these calluses around the fissures can be. This is a small burr operated electrically, and we have different sizes of burr. And you can see without using a surgical blade, we are removing this callus around the fissure, and it's almost non-traumatic. Patient has no sensations, so he doesn't feel even the vibrations. And when the callus is very thick, we have to use surgical blade to take care of very thick callus which cannot be removed by those burrs, electric burrs. Usually we use 10 or 15 number surgical blade to remove the callus. And remember, the callus we try to remove in pieces and not in one go. So you remove it bit by bit, piece by piece, and try to prevent injuries. Now this removal of the thick callus will make or ensure the healing of the fissure very fast. And you can see now all the thick callus around the fissure has been removed, and this has to be done periodically. Next. As I said earlier in the examination, the nails of diabetic patients are very thick. Sometimes they are crooked and have fungal infection. It's very difficult for diabetic patient to cut them because of age, diminished vision, central obesity. They cannot reach the nails. And if they are so thick, it is impossible for them to remove. I always tell my patients to get them cut by the spouse or family members. But if they are very thick and crooked, they should visit their diabetes clinic and get them trimmed, cut properly by the workers, diabetic foot caring nurses. Yes, next.
Sharad, you have
And
5 minutes more. You have 5 minutes more.
Okay. And you can see the thick nails being cut with surgical blade next. And we can heal these ulcers with this proper treatment next. 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 This is a typical hemorrhagic bulla developed on a neuropathic foot because the patient forgot to remove hot water bottle he had kept on the dorsum. Next. And as I said, majority of the amputations can be prevented by taking care of trivial foot lesions. Next. And we have to offload all diabetic foot ulcers and pressure points next by various methods like plantar cast and other adjusted boots next. And this is the tragedy when the patient loses both the limbs next. We can prevent all majority of amputations by detecting high-risk feet, educating the patient, wearing sensible preventing footwear, and managing trivial foot lesions. I'll just give a final video of education next. This is the last video video, Vijay,
There's no music, Sharad.
and it's 6 minutes.
There's no music.
Can you hear it?
No.
No.
There was a nice music we made, step by step.
Yes.
This is Dr. Fitfoot, and he is explaining how much our feet work throughout the day. We do not realize until the sensations are lost. So we should take care of our feet and try to everywhere the foot problem exists all over the world, and this is the end result of foot amputation, and this is how the foot gets injured because of loss of sensations, protective sensations. These are the simple tips on foot care. These are do's, don'ts, and danger signs. The do's are we should always check our feet every day for any injury, blisters, color change, or pus discharge. To look for the nails and get them properly cut. Always never walk barefoot outdoor or indoors. And if there is a wound, we should get it bandaged and covered and visit our. Every day the feet should be cleaned. We should take care of feet like our hands, and feet should be washed, dried, and interdigital spaces should be also examined. We should use lotions to keep skin soft because they have a dry skin. These are some of the don'ts we should remember. We should cut the nails very straight, and we have to file the sharp edges. Take footwear for rough nails or foreign objects. Many times they have foreign objects in the shoes. Daily wear a new pair of cotton socks, preferably white, and if there is pain, every time we buy the shoes, we should buy them in the evening when the foot is slightly swollen, so that the foot size is appropriate and they are never tight. Every 3 months, we should get them checked by our doctors. And we have to follow these don'ts. Don't keep your feet dry. Never walk barefoot. Otherwise, you are susceptible for injuries. If there is a redness, then it should be immediately reported to the doctor. Don't put your feet in hot water, even if it is very cold outside. Don't wear inappropriate footwear. The proper footwear which you're never use shoes or chappals We should avoid sleepers. We should always wear footwear which has heel counters. Never wear tight socks. Never do home surgery for any callus or injury. Avoid all sorts of home surgery, is very commonly done by our patients. Never use hot water bottle or never sit near the fire even if the outside temperature is very good. We should avoid smoking because it leads to vascular disease. In summer months, avoid barefoot walking, going to temples in hot summer. Avoid touching the exhaust pipe, which is very hot. And the danger signs are if there is immediately you should report to a diabetic foot clinic or diabetes clinic. If your foot becomes painful or it's red, is swollen, or if it is very hot or there is a pus discharge, we should immediately visit our doctor before the foot smells. It means there is an infection in the foot. If there are blisters or any such things, we should immediately go to the clinic. High temperature, nausea, vomiting are the signs of high blood sugar, ketoacidosis, which can be precipitated by diabetic foot. And always seek help from your doctor and not faith healers. Problem is global problem and should be taken care of. Thank you very much. I am sure with these guidelines, our educators will be more stimulated to take care of their diabetic patients. Thank you. Thank you very much.